Now, the first thing I need to do when I come in is make sure a person's bolstered effectively. So we have our round bolster. What's nice about the sheets here is I can just pull up both like this. And I could like potentially harness this and lift their feet up that way and down. I don't usually do that. I'm showing you that. A lot of times I honestly just reach completely underneath and search for the bungee of this and put this underneath that. But regardless, we always want a cloth barrier between the client and the material. Doesn't matter what it is. So ankles, and if I am figuring out where that bolster should be, if I put my hands right on their heels, that bolster should be right in line with my hands. I want the tops of their feet to be on the bolster. So that's an interesting thing where I compare where the two things merge together. Bolster goes in, I squeeze their heels, I can feel that their feet and ankles are supported well, and then I can go along. And I use this kind of rocking motion. And rocking is a technique, not to be underestimated. Moving the person's body rhythmically is relaxing. And we will be able to have that be a part of how we're able to go from one technique to another if we include this idea of rocking and oscillation. And we'll get a lot of information out of that too. One good place for initial assessment would be here. You know, tend to just hand on low back, hand right there in the middle of their upper back between their scapulas. So lumbar spine, thoracic spine. Take a nice deep breath for me. There we go. Good. You start to get your massage therapist voice going. Speak soothingly. I'm feeling for their ribs move more than their low back area. She breathed good. I felt movement here, meaning she's using the diaphragm and belly. And I come up here. All this contact over the sheet is a good way to start. It's like you're introducing yourself to the body before just draping and going into massage territory. And like even here, I can just rest my hands on either scapula, stare at my hands and see if one is higher up or further over than the other. The right one is higher up and over more. So it's kind of like, tends to be that way for the dominant arm, okay? So all that tells me maybe where a cave in a hill is, all right? And then do you have anything in particular going on?
Not really.
Okay, that's good.
Yeah.
So I'm going to pick just off of the one piece of asymmetry I found, which was the shoulder. I'm gonna pick the right shoulder as the one I'm gonna do last. Does that fit? Yes, it does with my with that. So starting on the right side of the low back, gotta move that blanket out of the way. I'm gonna use the seam of the blanket to help like kind of create a cutoff point for where the sheet will go. Right there, I'm gonna find the arm first. Bring the arm off to the side. Is that comfortable for you?
Yes.
Good. And the arm up over the head. Is that comfortable? Yes. So you see how we assessed abduction, flexion, all of that right there? I know the ball and socket joint and even the scapula aren't in too bad a shape. Now here's going to be, as far as draping goes, it's bunchy. I don't need to be grabbing the sheet and be tucking. I don't need to be creating a real sharp line like this. Better for there to be more material and weight covering the area. So I can bunch the sheet together, create a handle on either side, and move it that way. And it limits the tendency of having your hands go underneath the sheet, which is kind of the no-no. So bunch, creates a handle, move it, you're good to go. This sheet's big enough for me to even keep that whole arm still draped, all of that, but I have this other sheet if I wanted to keep on creating triangles and make it to where every time only the isolated area that I'm working on is being undraped. So that's the value of this extra sheet. You can see effectively, green is Sarah. Now here, in the order of our applications, we have to be thinking a bit more profound from last time and be remembering superficial to deep. We got to warm up the superficial stuff before we just suddenly go, whammo, 40 pounds of pressure, right? So visually with the shirt, the clothing is going to mimic in some ways what I am trying to do for the skin and the superficial fascia. It should be able to move in every single direction. There's going to be some places where anatomically it's a little bit more taut, like by the spine, but for the most part, this is a place where you can kind of move everything in directions and where, because of the lightness of your pressure, your body mechanics matter much less, okay? When we get to applying lotion, you don't want to apply a lotion fast and just immediately have that be the first thing touching the skin, because then you're not going to feel, you're going to be slipping and sliding. You won't be able to pick up on what the pliability of the superficial fascia in the skin is. So if there's scar tissue or there's some kind of adhesion stuff, you don't want to be draping, applying lotion, and already be slipping and sliding. You want to undrape, contact the area, move the skin and superficial fascia, let it just be a flowy, pretty thing, however you kind of pattern that. This is where I use my hands. My right hand is my predominant one there. Here's my left. Kind of just feeling, no lotion. The next part with lotion would be, now do that all again, but distributing the lotion. So it'd be 2 superficial applications. 1 no lotion, light over the skin, using my hands, then lotion, and I tend to distribute it over like larger areas, like the whole side of the back, the whole arm, kind of stuff like that. But once we've warmed that up, this is where, if I can, kneading on the torso is hard, but where I kind of will throw in some of those push-pull actions. And with that, it gets harder to do here. One of my favorites, you'll see it easier on the other side. You want like one of my personal crowd fan favorites is this hand grabbing a hold of the upper traps, this hand on the low back, and it's still a push-pull. And just kind of getting the cervical, shoulder area, lumbar area all at once. And that's where I can kind of start to have a little bit more pressure. So light pressure, then mid pressure, then we're gonna bring the forearm in. And I've warmed up everything, so now I'm gonna start using almost all forearms as much as I possibly can. Now where do I stand? It's gonna be on angles to the table, where a lot of times it should feel like both of your legs could touch. You find yourself in a position where like one leg is here and you're drifting. Usually it's going to be in this stance where both legs could touch, and then I'll switch and I'll go like this. So it's a lot of angles and across. All right, fall right into our routine. Angle, lumbar area, and across. That's at more mid pressure. Now I'm going to check in with her, the ideal amount of pressure. And I might have to get a little bit closer and come more straight down to confirm that. And I say, okay, tell me when the pressure is just right there. And then I try to dial that in and maintain that pressure even if I change my overall body and orientation. So about that much. I step a little bit further back, that changes my shoulder angle. Now when I move forward, I'm pushing in that direction. You can see your body shift now, right? So here, more straight down, just a compression. Here would be more what would turn into a glide. Over clothing, I'm stuck, so it's gonna be compression with a direction. Okay, here, I'm closer. It's gonna be more of a compression right in to the body. I step a little further back. Now it's gonna go across. Okay, we do a few of those. I end with lighter work. Like we sunk in some deeper pressure, and a couple a little bit lighter. And then moving on to the next area. A little bit lighter, mid pressure I should say, then sinking in, right? A little more, a little less?
A little less.
A little less. Prompt people. I'm heavy-handed, so I usually I've learned to have to, oh, there, good. Okay, good. So here, down on an angle. The deeper the pressure, the slower you go. And across. I'm holding these for like what? 1, 2, 3, 4. Maybe counts of 3 are a little bit better, but for some reason I tend to go to like 4 counts, a little bit slower. Okay, now I'm here. The arm in this orientation, it's not bad, but if I start to try to work higher into the upper traps and stuff, that might limit me. So I'm going to work here a little bit. I'm going to grab the arm. Okay, we're going to bring it over to the side. Right there is good. Now my working arm is this one. So this one's helping, but it is not my primary arm. I'm just going to be applying little actions. If I do this, I get crooked. Remember that whole idea of getting this non-working arm over and place it. Might as well go somewhere that's going to touch. In a lot of cases for me, it's contacting the area I'm going to massage next. So when I was up here on the back, this forearm was planted further up the back, and I just kept on working further up. Now I switch my legs. Now this hand's touching the upper arm. That'll be the place I go next after working on the areas between the scapula and the spine. So now here, if I step closer, I'm going to be more mid-thoracic, low thoracic. If I step higher up, I'm going to be getting more into the upper trap area, which would be the top of the thoracic area, but the angle of my arm, that L formation versus the V formation. Now once I'm here, if I wanted to make this more interesting, pressure okay there?
Yeah.
Okay, good. I can just apply a little bit of movement here. That changes the shape of the tissue under my left forearm. It's much more strenuous on your body to do things like this. That's gonna get you. So try to sink in and either let the pressure straight down do the work or find a direction, and eventually it'll have, you know, you'll start gliding across the skin. If you wanna have more of a sensation on a spot, then just include adjacent joint movement, and that'll create movement of the tissue just under where you're pushing. Cool. And I stand up, get myself set. The table might be just a little low for me. Once I get to the hand, I know that's where the pedal is, and I'm gonna fix it. Okay? Now, which hand I pick is just gonna be what is convenient. This hand, my fingers are gonna go into the armpit. So I pick this one, and it fits with where I was at. I went from here to here, and it's gonna just transition nicely to go right to this palm. Remember to try to work on the arms more in this orientation. If you worked on them going the other way, you could inadvertently hit that artery and nerve a bit. Probably wouldn't cause any long-term damage, but for a beginner to just limit your potential of doing anything, you can't hit anything you don't want to here. So there's a few good orientations. If I wanted to add more to working on the triceps, I could do something like this where I just hold the arm down as a way of like me securing it without gripping, and then use a forearm like this. My stance has to get a little wide to pull this off, but. And this is where I can show a little bit of the glide, or sink in, and then just let the glide happen entirely on its own. Come back, and we're gonna bring good down, bring our hand over on top. That's where I find, yeah, subtle difference, but now if we were to compare real quick. Now I'm not as nearly as bent over. I mean, it seems small, but one notch on the table can make a big difference for you, especially if, you're doing, say it's just one whole hour, but eventually it becomes, a whole day. So make those adjustments. Don't get stuck on a low table. Right, now here's a good example of like doing the light work. There's no lotion, but just kind of both hands, moving everything around in every direction I can think of. I'm not trying to really specifically turn it into a knead. I'm just going, that seems like a nice flowy way to go. That's a nice flowy way to go. And rather than doing a knead, it can be, this was a really good point by Sarah last week, if I hold this down, just fix it, and then push, that's going to cause a twist. So fix here, closer to the wrist, push, it's going to cause the twist.
All right, babe.
And then the magic trick, you're doing good work by the forearms. If when you push here, the fingers open up, that's where most of those muscles are. The tendons are here, so less pressure here. When you see the fingers curling, it doesn't mean you can't push. There's still pressure and work to be done here, but just lighten the pressure up compared to here. Okay? Really easy visual. Can't miss. Now, we've warmed everything up. We can do more of actual kneads. I've already started to do those. If I'm coming more across, pushing stuff straight down into the skeleton is going to be more stressful and a little bit more dangerous. So rather than doing this by the wrist, if I get on the side of it and push things across, that's substantially safer, okay? There's a small nuance with where my fingers are placed here, where I'll grip around an area and the fingers do kind of catch the tissue and it feels like a squeeze, okay? But I'm not doing this. Just around and then that'll cause that sense of a squeeze. There's a little bit of a pull happening with my left hand, but not big. And I just switch my feet. Some good kneads across. Those were kind of in the mid-pressure territory. Now I'm going to go into more of the deeper pressure. I'm going to protect the elbow. Also just keeps the arm on the table. Now my forearm can start right by their elbow. Note where my forearm placement is. This is a good place to show one. Every now and again, if you're really on the far edges of the table, you can switch. I picked that forearm versus this one because here, you're hitting their body and it puts the point of my elbow right into their forearm. So in order for me to use my forearm here, I do this way. And it's not going to mess with my body mechanics because I'm not reaching. But where I'm actually using my forearm is right here. Not too far over here. If I do that, I'm going to be tippy. So trust that you're not using the point of your elbow. You're using the flat distal end of your ulna. So watch those fingers. There they start to curl. I still glide, but I lighten my pressure a little. And then we're good. We'll do a couple of those, but we gotta move along as I'm chit-chatting. Great place for the soft fist. With soft fist, don't stand somewhere with your wrist crooked. Like I just know from having done this so much that the soft fist fits on an angle kind of lined up with the thumb, okay? So plant that and then I move my whole body around until my wrist is lined up. Pressure and I'm like, that's wrong. Aha, that's comfortable. I'll protect the thumb and then just rhythmic squashes and I can work my way all the way down. I tend to start oriented on an angle towards the thumb. And I'm going to line up my knuckles with each of the long fingers. So like the fingers are running this way, I just line them up and that's going to create that bend. for those muscles in between. I line myself up right with the index finger for the second phalange, middle finger, third, ring finger, fourth, pinky finger, fifth. We could just do a few rounds of those. But then I'm right here, cradle the wrist, tuck them back in, and we're good. If a person is kind of flopping, let's say you have a more narrow table or something, just tuck them in a little bit, and then their arm won't feel like it's gonna come off the table. Now, moving to the other side. Grab that upper trap as we're throwing in a nice pull. Works really good. So just stack both hands, big pull. Works good. I haven't had anybody complain yet. Then I'm standing the other side to just replicate all of that. Okay, arm off to the side, and then up over your head. Bunch. Contact. Move the skin. Pick the superficial fascia. If I can sprinkle in kind of like knead actions, that's fine, but for the most part, say just try to so use your hands. Don't let yourself start to get twisted with like you're kneading bread dough. Then mid pressure, sinking in on an angle, and go on across. Then more pressure, I'll check in with client, doing it's just right. Good right there. So note too, when working on the back, I'm going to tend to be angled just a little bit, right? I don't want to I want to be able to get close to the spine, but not come down straight on top of the spine. So there's just the tiniest bit of a lift here, just a little bit of that V formation, so I can get right by the muscles of the spine. The big ones there are called the erector spinae. But it keeps me, if I'm too much in the L formation, I'm going to come down right on top of those spinous processes. And you'd feel yourself on those. So even here, work my way up, light, and if I'm going to apply more pressure, I'm not like this, just a tiny bit, tiny. It seems so small, but it makes a huge difference. Couple there. Switch my arm, reposition their arm. Showing both hands. A lot of times I just grab them with the one arm while I have this planted, grab their arm and bring it over to the side. It's tough breaking things down when you kind of just fall into your own routine. When I work, it's mostly eyes closed, and fall into just kind of more of just such a pattern that's so synchronized that I don't even think about it anymore. And that's something that's easy to take for granted. That's one where you just want to condition yourself to starting in the same place, doing more or less the same applications in the same order again and again and again. So eventually you can get to a place where that's not even what you're thinking about anymore. You're thinking about what's the pliability of the tissue, what's the tone, all of that. There, move into the other arm. Run across, across. That'd be the lighter pressure territory. I could scoop under. I'm a little, we'll see how my body mechanics do with being crunched over here. Going up, do 1, 2. If you're picking a number, I guess 3 is a good cosmic balance number to do. Arm will go down. Warm everything up. This is where I'll use kind of knead-like actions to warm up the superficial tissue. So the first couple of needs were light, the next two were a little bit deeper. Now I know the first two layers have been warmed up. Then I cradle the elbow and use my forearm to apply the most pressure I'm going to in an area. So with that kind of order, I tend to do more sets of 2 or 4. So like I did 2 light needs, 2 deeper needs, now 2 slow, deep glides. And that really, in my opinion, covers everything you need to. And then add the third, at least I tend to add the third when I think there's a problem somewhere. Like I'll really slow it down and get more focused on a particular spot. Like I find a knot or a trigger point or something like that. If something pops, it's to confirm that it didn't hurt, but it's almost always okay. Like her wrist just had a good pop. I know it didn't cause any harm, but if you're concerned when you first cause a pop, just check in, like, whoop. As long as the pop didn't hurt, it's okay. Okay, now let's balance out. Come around. Grab a hold of both hands. Okay, then redrape. Now we're here. Trying to always contact both areas of the body and being mindful of where they're at as I move around the table, okay? And I have to be aware too, my lotion bottles count as part of me. So one thing that can go wrong perception-wise is going around and knocking people's arms, especially with your lower body, okay? The easiest way to mitigate that is keep your hands on them so they don't have this sense of disconnect in the massage. Also just kind of protects you from making that inadvertent contact because you're just not going, okay, and then walk on by. Now if her arm was off the side of the table, I could really hit it with my knee, right? So keep your hands contacting and that'll get you where you need to be. Now, working on the hips, we talked a bit about the anatomy here and why I need to pick 2 important areas where we have, well, I'm not going to worry about turning it. We have gluteus maximus versus those deep lateral hip rotators. This isn't too hard to find. You know, you rest your hand just usually right where the low back lumbar arch ends. With the clothing, it's going to help you because it's going to basically be the belt line. Okay. Here's some joint movement. This will be the joint movement that we're using. So that's external hip rotation, internal hip rotation, and then we have our knee flexion, knee extension. Now for the hip, right here, the only movement that would matter would be doing this for a while I'm working here to cause a shape change in the pit tissue that I'm actually compressing. So first application is going to be, I'm setting my arm, it's going to be very much 45-degree angle, very robotic. Okay? Versus when we get to the deep lateral hip rotators, since they're oriented this way, I'm going to turn my arm more horizontal. So first one here, second one here, and then incorporating that joint movement. So first one, right there, and then for this one, this ends up working better because it keeps me a little bit less crooked. And if I'm just generically picking a joint movement to focus on, I'm going to pick, while I'm compressing gluteus maximus, external hip rotation. It's just easier on me, and there's some hip muscles here that when I turn her leg enough that way, I might turn them up into me. There's 3 glutes. There's gluteus maximus, and then there's a gluteus medius, and a gluteus minimus. But those muscles are more on the lateral side. of the hip. So I just find for working on the glutes in general, turning the leg this way into external hip rotation works a little bit better. More comfortable for me, more effective. Now coming to the deep lateral hip rotators, I can feel that greater trochanter right there with my elbow. It's right there. So I want to be just posterior to it. I don't want to push down into it. I got to push on an angle into the table. So it's like, here's the trochanter. I want to be above it, and I want to go on an angle this way, not smash down right on top of it. So I find that, change my elbow orientation, my forearm orientation to be more lined up with their leg, lined up right with their femur. And then this one, that greater trochanter, that bone on the side of your hip, if I turn it this way, I'll roll that bone up into me. And that would be uncomfortable, but also I can identify, I'm like, okay, if I roll it this way, I can feel where it is, confirm I'm in the right place, okay, cool. If I bring it this way, bring the hip into internal rotation, stretches those muscles and moves that bone away. So it's a way to pin the muscles and stretch them. So there is a technique called pin and stretch. As a compression, I shorten the tissue, I compress it, and then I lengthen the tissue. And that is a fancy muscle energy technique. Not really a muscle energy technique in the same way that other ones are, but it works really good. Okay, now I'm already here. I can just drape. Here's the thing for the legs, okay? No drafts. With the blanket and the sheet, I want lots of sheet between the legs, and then I don't have to worry about anything. If I had this more taut, now it becomes a problem. So no drafts. You take the bunch, and I make sure it's like that. If I had to, if this sheet was too small, I would rather be in a position where a client is like this, and I can use this sheet or even the fitted sheet to cover them all up and bundle them, make sure they're warm and cozy, and I don't have to worry about the sheets going anywhere. So that's by far the only really big hack I have for you is make sure that sheet is clumped up and contacting the outsides and insides of the body. If you do that, you're in safe territory. Right here, I could use a palm here, could use a soft fist here. In this case, I'm going to use a soft fist because I'm going to manage, I'm a little cautious, like open palm fingers going on the inner thigh. So I can do a pin and pull. Now this is creating a need. It's not any different than me doing this, right? A push and a pull. I'm just going to contact, and I'm worrying about the outside of the leg to start. I can get this whole lateral. It's like posterior lateral. Posterior is the back, lateral is the outside, medial inside. But I can get this posterior lateral chunk really easy and prone. That posterior medial chunk is hard to get to. I have to do stuff like come over on an angle, or I could reach across the table. I have to do a lot of gymnastics with my body to pull that off. If I do just this part and save the rest of that for sideline, that's the more efficient mode. So I'm worried about just this outside section. So push, pull, and I can do these on like small angles. Now that's going in a different angle, knee flexion, extension. Showing soft fist because see how like I'm right against the sheet? My fingers are up underneath there. So the trick with the soft fist is you should be able to see all your nails. That way your knuckles actually have a little bit of, the joints of your fingers have a little bit of flex to them. So they'll contour to the person's body. A lot of times people can't tell the difference between that and a palm anyway. So Here works really good. So I can rhythmically sneak all that joint movement in. I could do that here with a forearm too. It's the exact same thing. So push, pull. I just have to make sure I don't hit myself in the head with their foot. I hit myself in the head with their foot. The same things, just harder for you to see when I do that with the forearm versus soft fist. Down, right here. Little trick I have here is I just grab the whole side of the calf with one hand and it kind of pulls the tissue over this way. And it's less bony. If I do this, sometimes their leg will roll out and they'll feel like you're just smashing into their fibula. So if I kind of just gather this, see how it kind of turns her leg and holds it there better for me? Now I'll be more in those calf muscles. Gastrocnemius is the big one. So here's some superficial pressure. I'm not gonna be too cruel. A lot of people have sensitive calves. And pushing on them in this orientation, where you're squashing the muscle into the bone, is usually gonna be more ouchy. So like I can feel a little thing there. Pressure, okay?
Mm-hmm.
Yeah. I can feel a little bit, something more tight right there in that area. So I slow down and I hold the compression a little bit longer. And then just change my orientation. Squash in a few directions. Work my way down to the Achilles. Now I tend to use my forearm here because I can let my pressure up. This is where I want you to get coordinated with your forearm so you don't have to necessarily change. But you could like stop right here, stand, and do more of this push-pull action like this, down to the Achilles. Okay, then you're done. That is the leg. If I have a transitional thing that I do down here, I just squeeze a hole of those heels. It's the same principle that for the most part, I'm pushing with my palm, my fingers are just catching. I work my way around. One time I kind of reach, is here. That gets me to the other side of the table. I grab all their small toes, give those a bend like that. And I'm here, I can re-drape. There will always be a tangle, and draping over clothing is way harder than when they're undressed. The sheet will catch on there a lot. So you see right here, I made sure, where am I tangled? There we go. Sheet bunched, knee bent, here, 45 degree, gluteus maximus, hip external rotation, 1, 2, and 3. Work my way down, where I have my arm where it's more in line with their femur, more horizontal. I can feel for that greater trochanter by taking the hip into external rotation. But if I bring it into internal rotation instead, and I can feel a little bit more resistance there. My compare and contrast assessment is that her right hip is a bit tighter than the left. I'm going to just hold the compression a little bit longer. I think I already did 2. I'm going to do 2 more. And call it good. Okay, here. Hold the sheet. See, that allows me to adjust this without even having to like move the whole thing. Then soft fist. Warming everything up. I'm going to apply more pressure. Now I can feel, and you'll get to a point where you kind of get a good gauge across the person's body about how much pressure they're tending to prefer. And that'll get easier and easier. That's why I bring those scales out to give you a sense of like what does doing 20 pounds of pressure look like and feel like versus 40. But be okay with consistently, as you're trying to approach applying more pressure for people, to just do a consistent check-in. After warming up everything superficially, sink in and tell them to tell you when the pressure's just right, as you just keep on applying more. You tell them it's just right?
Okay.
Okay, is it already too much?
No.
Okay, good. And even here, this little bit of joint movement. Then I lighten it up. And we're good. Switch my feet. So I tend to stand at the knee, step away from it towards their foot. That's how I get all the good angle for the hamstrings. Stand at the knee, step towards the hip. That'll give me a good angle for their lower leg. Push, pull. Push, pull. You don't have to keep on switching your feet. Like I tend to keep the palm closest to the Achilles, staying as the push hand, because then that one can work lower and lower and push more directly on that Achilles. I know I'm going to get the other side of it once I turn around our side. Okay. Heel squeeze. Move around. Moving some toes while squeezing a heel. Reset. And we're done in prone. And next we go to side leg. We're doing just fine.